Hi, this is Emma Krasansky in collaboration with Dr. Christopher Steele presenting the Health Equity Teacher Module, Racism, a Social Determinant of Health. The objectives of this module is that at the end, learners will be able to define race and racism, differentiate between different types of racism, and describe racism's impact on health. To begin with, let's define race. Race is a social category which can be based on nationality, ethnicity, phenotype, or other markers of social difference. Common races that we think about that have been socially constructed in the United States are white, Black, Asian American, Latino, and there could be many more depending on what country you're in, what society you're in. Again, it's a socially constructed concept, so it'll differ depending on where you are. Some key points to remember about race is that it was socially constructed over the past several centuries to perpetuate power dynamics. You see that in the United States between the white and Black races and the history of slavery that our country has been based off of. Another thing to remember about race is that it is not biologically based. A study of genetic structure within human populations finds that there's more genetic variation within racial groups than between them. That's important because we'll talk about how race and racism impact health and how race is not biologically impacting someone's health. Last point about race to remember is that race is not a social determinant of health, but different racial groups can have greater exposure or lesser exposure to certain social determinants of health because of the way that racism has impacted those races, which we'll talk about coming up next. So next, what is racism? Racism is an organized social system in which the dominant racial group, based on an ideology of inferiority, categorizes and ranks people into social groups called races and uses its power to devalue, disempower, and differentially allocate valued societal resources and opportunities to groups defined as inferior. That is a long definition, but in short, it's the superior or noted superior social group or race using their power to discriminate, prejudice, have biases and spread stereotypes and disempower those races that have been identified by society as inferior. Now, some key points to remember about racism is that racism is adaptive over time. So there's many different forms of racism, which we'll get into, and over time, different forms have become more prevalent, less prevalent in a society, in the society structures, in order for racism's effects and the power dynamic that it supports in the society can remain as things change in society and other forms of racism have diminished, others become more prevalent. Another note about racism is that racism interacts with other social institutions to reinforce, justify, and perpetuate a racial hierarchy, which we'll get into a little bit later. But just know that it is a full-on structural societal process and system. Lastly, about racism, while race is not a social determinant of health, racism is. Racism is a social determinant of someone's health. It will drive inequities in other social determinants of health, food access, housing stability, transportation access, insurance, income, all those things, and the structures that direct those things are affected by racism, whether it's within policy, within practices, within interpersonal communication. Everything is driven by racism within the society to create those social inequities that then create those social determinants of health, making racism the underlying social determinant of health. We'll get into that with an example later. But first, I'd like to talk about the different types of racism. that we have identified. The first is what you may think of when you think about racism, interpersonal racism. And this is racism that occurs in between individuals, whether it's words, actions, and it's driven by either explicit or implicit bias. Explicit bias being your conscious thoughts and beliefs, implicit bias being the unconscious beliefs, ideas that have been ingrained in us over time by our society structures involuntarily, and they do affect our behavior, which is why they can drive racism. Now, interpersonal racism, like I said, it can be verbal, it can be through actions, it can be more overt, or it could be less overt and less visible. An example of a type of interpersonal racism that is considered less visible and more subtle is a microaggression. A microaggression is an indirect, subtle, or unintentional discrimination against members of a marginalized group. This may be in a comment that you make, a remark that you make. It's sometimes unintentional or it could be intentional, but it's something that happens more day to day and can be slipped into conversation that you may not realize has an impact on the targeted individual, but it does. Other examples of interpersonal racism can include stereotypes, harassment, exclusion, marginalization, discrimination, hate, and violence. The next type of racism I like to discuss are two that kind of go together. So institutional racism is policies, practices, and procedures and culture of an institution or system that work better for white people and cause harm or hardships to people of color. So this compared to structural racism, which has a very similar definition. Structural racism is the history, culture, and current reality of racism across institutions and or systems, plural. So basically it's when institutional racism of multiple institutions overlap to kind of form this structural web of racism that underlies the entire society as the institutions interact and influence a single individual or group of individuals. This institutional and structural racism is not so commonly thought of, but it does represent how over time and through our a country's history, how racism has been ingrained into laws, legislation, practices, how you do things, how a culture goes about things. And it perpetuates racism within a society without the need for interpersonal racism, and it also can fuel someone's implicit biases as they live in a society that has these institutional and structural racisms. Some examples I'd just like to give of institutional structural racism is racial residential segregation, which we'll get into a little bit deeper later. But over time, through legal segregation in the 20th century to in Jim Crow to post-civil rights era desegregation and integration, we still have segregation among our residential areas, who lives where, and this has been driven by explicit federal policies or also through support of private policies by the government, like discriminatory zoning, mortgage discrimination, redlining, restricted covenants, which forces people of color to live in a certain area away from white individuals and population. And then within those areas, they typically have less access to resources that then furthers and perpetuates their lower socioeconomic status than the white population. We'll get into that cycle later, but that's one example. We also see racist policies and practices within our criminal justice system through mass incarceration, death penalty, profiling, and the war on drugs. Even in our education system, starting at a young age, we see that there are racist policies and practices, specifically with the disciplinary measures that have created a school to prison pipeline. And then healthcare, which we'll get into a lot more later, we see more illness, worse outcomes, and premature death for minority groups compared to whites. Now, there's a lot more to these institutional and structural racisms that I have not dug deeper in for this presentation because this is an introduction, but I do encourage you to look further into whatever institutional and structural racist policies and practices may be at play in the institutions that you are involved with. Another type of racism is internalized racism. And this is when there has been internalization of the racist stereotypes, values, images, and ideologies perpetuated by the white dominant society about one's racial group. So in short, over time, the stereotypes that exist in society, the racist practices that exist in society are then ingrained in individuals to believe them to be true, to accept them, and not combat them. We have internalized racial inferior and internalized racial superiority, and that kind of just goes to show that both the inferior group, the group that is being discriminated against, can internalize the racism, and their socially ascribed inferiority, or the superior group can also internalize their societal position of superior. And the internalized racism is one part of why the racist structures within our society continue to exist and perpetuate themselves. Now, to close off this presentation, I'd like to talk about racism and health. This is a very complex relationship as it works in several different ways. But here is a little introduction to how racism can impact an individual's health. The first part I want to talk about is racism's indirect impact on health. And what I mean by that is what I talked about earlier about how racism is a social determinant that can also drive inequities within other social determinants. So the way that structural and institutional racism have affected the distribution of goods in our society, access to goods in our society, our laws, policies, and practices, has driven and created inequity in social determinants, putting minority populations at higher risk for many social determinants of health, like housing instability and poorer housing conditions with our racial residential segregation, which we'll get to, food insecurity, lack of transportation access, low income, and lack of health insurance. And because of racism, the structural and institutional racism, putting these minority populations at higher risk for poor social determinants of health, those poor social determinants of health and the higher risk for them then create poor health outcomes for those individuals indirectly. An example that I want to dig into is racial residential segregation. And this example is a great example because it shows just how complex the relationship between racism, institutions, and social determinants of health are. So beginning of the 20th century, you have legal segregation. Blacks and whites lived in different neighborhoods, different areas of the city, suburbs versus city, urban living. But then in the 60s, we have that the entire civil rights movement that occurs. And then at the tail end in 1968, we have the Fair Housing Act that made housing segregation illegal. One would think that once this law was created, then we would start to see some integration of the neighborhoods between different racial populations, minority groups, but that has not been seen to be true, as we see that racial segregation in residential segregation still exists because of federal policies, discriminatory zoning, mortgage discrimination, redlining, and more. The history is extremely interesting to look into, so I encourage you all to do so. But essentially, policies and practices within our society allow for individuals, businesses, realtors, etc., to discriminate against our minority populations to keep them contained to different neighborhoods that have lower resources, worse living conditions. And then there we see that the institutional and structural racism also allows for disinterest and divestment in those communities. So we see that the initial racism that causes segregation and then the racism within our institutions that perpetuate it and affect the other resources in that area leads to reduced access to quality education for minority populations, less preparation for higher education, less employment opportunities, which leads to a lower socioeconomic status for our minority populations and our Black populations. We see that it enables a higher level of neighborhood crime and violence, physical and social conditions in these neighborhoods that elevate exposure to physical and chemical hazards, whether it's proximity to landfills, businesses, chemical exposures, Superfund sites, anything like that. It also are usually minorities and Black populations are typically segregated to environments that make it harder to practice healthy behaviors. So there might not be parks around, there might not be infrastructure to go outside and exercise. There may not be stores around providing fresh produce and food for a balanced diet. We also see that the residential segregation also influences availability and affordability for healthcare. That was a ton of stuff. But essentially, we have the racism that causes the residential segregation, and then that residential segregation then impacts those individuals' access to all these resources, and their social determinants of health are altered to be poorer, which will lead to poor health outcomes that way. The indirect pathway, as I kind of described earlier. That's just one example, and this explanation definitely does not do all the details justice, so I would definitely recommend looking into it and learning more about what racial residential segregation may be present in your area. Now, for racism's more direct impact on health, this kind of highlights racism within the healthcare system. So on the patient-provider relationship level, we see provider bias, stereotypes, prejudice, and discrimination culminating in inferior medical care for minorities compared to white individuals. This can be seen through fewer procedures and poor quality of health outcomes across the board in many different specialties and areas of health. We see that it affects both mental and physical health of these individuals and populations in their health outcomes. Internalized racism, which I spoke about before, specifically has been associated with lower psychological well-being, higher level of alcohol consumption, depressive symptoms, and obesity. Self-reported discrimination has been associated with increased allostatic load, inflammation, shorter telomere length, coronary artery calcification, dysregulation of physiological processes, and greater oxidative stress. So this kind of highlights how racism can have a huge physiological impact on an individual that we've been able to identify, as well as stereotype threat, which is a concept where the individuals who are populations who are discriminated against and who are expecting to be stereotyped by their healthcare providers have increased anxiety, impaired decision-making, and increased unhealthy behaviors, poor patient-provider communication and trust, and lower levels of adherence to medical advice. So even just the expectation of stereotype can impact someone's health. And this is just a visual that I wanted to close off the presentation with. There's a lot of data that you can look at in regards to health outcomes as a result that have been correlated with racism and race in correlation to health outcomes. But, and I encourage you to look into those associations between race and racism and health outcomes within your specific medical field. But for now, I wanted to keep it general and just look at life expectancy. So this is comparing 2019 to 2020 life expectancy data for Hispanic, non-Hispanic white, and non-Hispanic Black populations. As you can see in the graph to the left, we have Black populations with the lowest life expectancy, Hispanic populations with the highest life expectancy, and whites with the middle life expectancy. But what I want to point out here is not the different levels, but the changes in life expectancy in the past in that past year between 2019 and 2020. We see, which we can see with this graph on the right as well as on the left, but the change is what is graphed on the right over the years. We see that between 2019 and 2020, the Black male, Hispanic male, Hispanic female, and Black female have a much larger decrease in life expectancy in just 1 year than white females and white males, which is insane that in just 1 year we can see that disparity in life expectancy change. And something that we can think about, which may have contributed greatly to this, is the COVID-19 pandemic, which we've seen through several data sets that have come out throughout the year of our minority populations being greater affected by COVID infection, COVID hospitalization, and COVID death. So we see just that case study example in just 2020 of how racism has influenced health in a pandemic. And we see that racism is a social determinant of health that clearly impacts, just at that service level data statistic, life expectancy, with Blacks having such a decreased life expectancy compared to whites, as well as a higher rate of decreasing life expectancy over the years. That wraps up our first presentation for our Racism Within Medicine module, Racism, a Social Determinant of Health. Stay tuned for another presentation that goes deeper into the history of racism in medicine and how to approach medicine as an anti-racist. Thank you.